To Apollo Bramwell Hospital for hosting us today, for inviting us, and particularly for this interesting talk that we're going to have, I know. Just to say a few little words about WIN. WIN continues to grow. For most of you that don't know, we've now become a not-for-profit limited company. That happened last September, so we now have a board as opposed to an executive committee, but the work is much the same. So whether it's the networking events, whether it's the WIN Leadership Program, whether it is Women in Politics, or whether it's Men Against Violence, those are our four main platforms, and we continue to work very hard on the ground. So this is really one of the first of a series of networking events this year. We've looked at women's health in the past, but breast cancer is the biggest problem for women in terms of cancer in Mauritius, and I'm sure we'll hear more about that. So it's nice to see so many of you here. It's nice to see not only women but some men as well, that you look after your wives, your spouses, your children, and think about your relatives as well. So welcome to all of you, and I'm going to pass back to our Mistress of Ceremonies.
Thank you, Ms. Walls. I would like now to call upon Mr. David Gray, the Deputy Chairman of Apollo Bramwell Hospital, to please address you. Thank you.
Thank you very much. Good evening, in particular, ladies, and a very warm welcome to our gentlemen. One of your members, I had a meeting prior to this, and she said, "Oh, Gray, that's a famous name." And I thought she was referring to David Gray, the pop singer, but she was referring to a recent series of books which have gained some notoriety. Sadly, I'm neither of those represented in the book or the pop singer. You're very welcome. I just wanted to say a few words. I wanted to start by a speech and by a quote, and I was going to go to type and put an American accent on, but I thought that might offend some of our ladies. But if I may quote, women in particular need to keep an eye on their physical and mental health. Because we are scurrying to and from appointments, jobs and errands, we don't have a lot of time to take care of ourselves. We need to do a better job of putting ourselves higher on our own to-do list. Michelle Obama. So I'm delighted to welcome you tonight and to contribute to sharing in the knowledge about women's health and in particular breast cancer. For me, having been involved in healthcare for 40 years, it's a no-brainer in that women are far more sensible and sensitive about health issues and are the drivers of the family's health care. I'm sure you've heard the quotation, "Behind every good man is an even better woman," and I think this applies certainly specifically about health care. Today's woman is a lover, a mother, a home builder, a chef, a psychologist, a teacher, and a businesswoman, and that's just some of the jobs. Such demands require special support for women's health. And again, another quote, "Women who seek to be equal to men lack ambition." At Apollo Bramwell Hospital, we are developing a centre of excellence in mother and child care to ensure that the women of Mauritius get the best care they deserve and to bring contemporary women's medicine to the island. And I'll finish, if I may, with another quote. My wife likes to say that if you don't have women in the top places, you're not just missing out on 50% of the talent, you're missing out on a lot more than 50%. David Cameron. So I hope you have an informative evening, and we are committed to women's health. We are working and will by July have a centre of excellence in women's health. It's been led by a woman, Valerie Rawat, so we have placed women in leadership of this initiative, and hopefully we'll contribute to your health and well-being and the future generations of women in Mauritius. Thank you very much.
Thank you, Mr. Gray. Ladies and gentlemen, we now have the honor of having Dr. Veera Sami Damodaran, Senior Consultant in General and Laparoscopic Surgery, to give us a talk on the truth about breast cancer. Dr. Damodaran specializes in breast and colorectal surgery. He has had more than 20 years of experience in general surgery and 15 years of experience in the endoscopy division. He is also a member of the Fellow of Royal College of Surgeons of Edinburgh. Welcome, Dr. Damodaran, please. Thank you.
Good evening. Welcome to Apollo Brahman Hospital. I think the chairman of the wing said the breast cancer is concerned with only for the women. Sorry, for men also. 1 to 5% men do have a breast cancer. Before I start my lecture, please note that I want you to be very carefully to watch this first slide. Breast cancer, definitely it's curable if it is diagnosed early and getting a treatment at the early hours. When I worked in the UK for 10 years, I have seen many ladies, they've been following up. Usually the notes says, the surgery of breast cancer or chemotherapy for the breast cancer been done 30 to 40 years before. Still people living very happily. So the idea is the early diagnosis is the most important to treat the breast cancer. And beware of painless lumps. Any lumps, it doesn't mean that all the lumps in the breast are cancer. But if any lump without any pain, we need to have a small suspicious. Be careful, but don't panic if you have a family history. I will come detail about the family history after the 4th slide. The problem is in Mauritius. As an oncologist sitting here, he knows about the 30% of the cancer diagnosed in Mauritius is in a breast cancer. And every year it has been increasing. This is the last year report. I think the 2012, we haven't got the report. It must be 37 or 40%. Most common malignancy among women all over the world, not in Mauritius. And it is very high in America as well. And occurs in very young age group. Recently we have seen a lot of ladies, we never expected those people will have a breast cancer. Around 35 to 40, they do have a breast cancer. So there are some risk factors. We don't know what is exactly the reason for the breast cancer to occur, but we know that there are some risk factors and preventable factors also. If your mother, sister or daughter or your grandmother had a breast cancer, you have tendency to have a cancer for threefold, that is 3 times the normal one. Or if you have an auntie and cousins, if anybody has a breast cancer, they have also the high risk groups. Certain genes such as BRCA1 and BRCA2, which is, we can take it from anybody's the blood samples. If the gene is positive, you are going to have a breast cancer. It doesn't mean that you are going to be killed by that disease. If you have the genes, it means we will treat more aggressively when compared to others. Personal history. Anybody is menstruating, the first menstruation before the age of 12, or anybody is having a menopause after the age of 50. Normally, the Asian setup, we have it starts about 47 to 55. but in the Europe, these menopause is around 60. So what I'm trying to say that early menstruation, late menopause, it is one of the culprits. The reason for that, estrogen is one of the hormones. You have two hormones, estrogen and progesterone. Whenever the estrogen hormone is very high, then you have a tendency to have a breast cancer. Suppose a girl about at the age of 11 or 10 have a menarche, the first menstruation. She has to live for a long time. She is going to have an exposure about many years of estrogen. And the same as in the menopause. More and more you are not getting menopause. Suppose if the patient has 70 years, she is still menstruating. The chances of breast cancer is very high because of the continuous circulation of the estrogen. The same factor for the nulliparity. Why that without any issues or anything? So why the nulliparity? No children. If you have a pregnant, the chances of estrogen will be less at the time for the whole of 1 year. That is why the reason is nulliparity is one of the risk factors. And absence of breastfeeding. I have seen many people, they used to give, when I see a lot of people in my breast clinic, I used to ask how many months you have given a breast milk. Only 3 days, doctor, or 3 months. 3 months is fine, but 3 days is not acceptable. The reason is when you are giving a breast milk, the estrogen and progesterone level is going to be very low. So this is the chances of suppression of the hormones that will help you to prevent to become a breast cancer patient. On the late first childbirth, people, those who have first childbirth after 35, they used to have a tendency to have breast cancer. But all these factors, it doesn't mean that everybody should have. The chances is very high. So what are the symptoms? Some people will say only they feel the lump, a small lump, thinking that it is only cyst. We used to call it kyst. It's not like that. Any lump in the breast, we need to evaluate and find out what is the reason for the lump. So people normally present with a lump, or there is a dimpling of the nipple, and the change of the color of the skin and texture, and there is a blood discharge from the nipple, as well as the nipple looks like. Sometimes the nipple will be buried inside the breast. So what we used to do that, we will evaluate. Evaluate means we'll do first the clinical examination in the breast clinic, and after that if we have any suspicious, even it depends upon the age. If the age is more than 40, we always advise them to undergo a mammogram at the same time an ultrasound of the breast. If we suspect some nodule, anything by clinical examination or by ultrasound or by mammogram, immediately the patient has to undergo is a test called fine needle aspiration biopsy. If it is an ordinary needle, will be put on the lump, aspirate and see what is happening in the pathology department. And if we have a doubt about we couldn't find out the nature of the lump, then there is another test called true cut biopsy. It's nothing but another needle test. So I think most of the people will know about the mammogram. I agree the mammogram is a little painful, but it is very short period. It's in about less than 5 minutes. Mammogram is a process of using low energy X-ray to examine the human breast. It is used as a diagnostic tool to find out any abnormal shadow or abnormal structures present in the breast. If you see that, they used to compress on each side one plate will be above, one plate will be below of the breast. That's why the people used to have little bit of pain. But the pain, we are not worried about the pain. Of course, we have to worry about it. But the most important thing, that mammogram is one of the best diagnostics tools so far it has been discovered to find out the breast cancer. So this is a typical picture. If you see that there is a white spot, that is, we have a suspicious. We need to know what it is. So the mammogram always look like that there is any white patch, if it is present on the mammogram, then we will evaluate again. Before mammogram, I always request the patients not to put any deodorant or perfumes on the arm or the shirt, because this deodorant will give you a false information on the mammogram picture. So the mammogram is the only tool to find out early detection of breast cancer, typically through detection of characteristic masses and or microcalcification. Microcalcification is nothing but small dots we will see in the mammogram. So that is a significant for us to diagnose the breast cancer. So this is a fine needle aspiration. A fine needle is passed into the breast lump repeatedly, it means 2 or 3 times, to collect the cells. The aspirate is seen under the microscope to know the characteristics of the cells. It's done, it's in the OP procedure. It is, of course, there is a needle prick pain, but it is very comfortable. Everybody can have that one. Truth cut biopsy. Suppose if I have the lump has been diagnosed, the pathologist told me that we are not certain about the nature of the lump, at the time we will do the test called truth cut biopsy. This is nothing but a thick needle under local anesthesia. We will target on the lump and then remove the tissues. It can be used for most advanced studies, especially the receptor studies, that you may not understand now, I will come back to later. Also done as an OP procedure under local anesthesia. So, in the breast cancer, the most important thing is screening. The screening and early diagnosis. Early diagnosis of breast cancer can avoid mastectomy. Mastectomy means removal of the whole of the breast. The recent trend is, if the tumor or lump is very small, about less than 3 centimeters, it can be taken out without taking a whole of the breast. We can remove only the targeted tissues, and then you will have the same amount of breast tissue. As a clear survival advantage over delayed diagnosis. If a patient comes with the first and second degree of breast cancer, we all know that the patient is going to live for a long time. Suppose if the patient has multiple lumps spread everywhere into the body, the chances of living is less than 5 years. So what you can do you can do on your own examination. It's called the self-breast examination. This can be done in front of a mirror. There is a pamphlet, a lot of pamphlets are available. I think you can have one see. And examine your own breast, the manner it has been described clearly. If you have any small amount of suspicious, maybe nothing, but it is better to go and see a doctor. It should be done every month after the periods. If you have a period, please leave a 2 days and then take it as the 3rd day. Every month you examine, and I think 99% of the diagnosis will be over if you do the self-breast examination every month. If that helps the lady to get accustomed to feel her breast and helps in early diagnosis of the breast cancer. The mammogram also, it has to be taken, not to be taken at the time of the periods and not to be taken a week before your periods. So we do have a breast clinic. We are conducting every Wednesday between 9 to 12 o'clock. It's a one-stop clinic for all breast problems and answer to all your queries. Consists of highly qualified team about the surgeon, radiologist, pathologist, and oncologist. All treatments are based upon the international standard. It is not a one-man's decision. And it also depends upon the patient's wish also. So what is special? All screening tests such as clinical examination, ultrasound of the abdomen, mammogram are done on the same day. FNAC, that is called as a needle test, will also be done on the same day. And all reports will be discussed within 48 hours. If the patient comes on Wednesday, we will ask the patient to come back on Saturday morning to know the results. So who can attend the breast clinic? Any woman who wants to be the breast healthy without unnecessary anxiety. But I just warn you certain things. A lot of people, they used to come about 20s and early 30s. They insist they should have a mammogram. The mammogram, you will not see anything in the younger age group because of the two reasons. One is young breast is very dense, so the X-ray will not pass through. Number two, too many X-rays in a lifetime, we won't advise. So the ideal age is above 40. So how long you have to do it? The mammogram has to be taken once in 2 years, normal women. If you have anybody has a relative have a breast cancer, it has to be taken every year. And please don't repeat every 6 months. You will not see anything in the mammogram. So we have our breast clinic package. It is all the test, mammogram, FNAC, clinical examination, and ultrasound. Everything will be done as in a package basis. Because if you calculate all the tests separately, it comes around 6,000, 6,500. So the administration has given permission to allow to get only 2,750 for all the tests, including our examinations. For appointment, please contact the Apollo Bramwell. Any questions?